Good afternoon. Thank you for joining us today. It's great to see so many of you participating on this call this morning. We have a treat for you. Colonel Barbara Fick is going to be talking to us about COVID-19 and the impact on Latin America. She's an absolute expert on this topic, and I'm sure she'll be able to provide a lot of interesting insights this morning. For those of you who are new to FPRI, first a few little housekeeping notes. We have a chat function, and if you want to ask questions, if you look at the bottom of your screen, you can click on the chat button, and there should be a chat column to the right. It's on the right, at least on my screen, where you can ask questions and type in your questions. So be thinking of those during our presentation this morning. Also, I see many friends of FPRI out there, but I also see some new names and faces. So for those of you who aren't familiar with the Foreign Policy Research Institute, we're headquartered in Pennsylvania, but we like to think we have an international reach. We have friends all over the country and all over the world. We are a 501c3. We are a non-partisan organization. Although I will say we have more than 100 affiliated scholars and senior fellows, and they represent the full political spectrum. We give the story behind the story. We are not into political polemics and diatribes. We require our scholars and fellows to address topics in a civil and evidence-based way, but we do not dictate what their political positions should be, as we are nonpartisan. So let me talk a little bit about Barbara Fick to get us started. Barbara is currently, she's an active duty Army, U.S. Army colonel who has a really extraordinary background. And I think of her as a world traveler and a writer on Latin America and international affairs, but she actually hails from nearby. She grew up in Bucks County, Pennsylvania, and still has a lot of family in the area. On her background, she's currently the director of the Department of National Security and Strategy at, she's the America's director in the Department of National Security and Strategy at the U.S. Army War College in Carlisle, Pennsylvania, which is where she is today. She previously served overseas. She was the senior defense official and the defense attaché in our U.S. Embassy in Asunción, Paraguay. She also has other overseas experience. She was strategic advisor to the commander of the International Security Assistance Forces in Afghanistan. She also was the strategic plans and cooperation chief at the U.S. military group in the U.S. Embassy in Bogota. So she has lots of overseas experience. She's also, her previous job was political military affairs chief at U.S. Southern Command. She's held other senior positions, including strategic advisor to the commander of the International Security Assistance. Oops, I already said that one, in Afghanistan. Special assistant speechwriter at Supreme Headquarters Allied Powers Europe. She's written many publications on Latin America and international affairs, and I think we're going to have a really interesting discussion this morning. What I've asked her to do is make some initial remarks for 10 or 15 minutes, and then I will ask her a few questions, and then I'll open it up to our questions. And again, as I said, use the chat function at the side of the screen and start thinking about your thinking and writing down your questions. So without further ado, Colonel Fick, would you like to say a few words?
Well, thank you very much, Raleigh. It's really a pleasure to join Foreign Policy Research Institute and this group for today's conversation. And I will say, we're all learning new ways to do our jobs, to work, to play, connect, going through social distancing. And to my Miami friends, having moved from Miami to Carlisle, I've experienced a unique form of social distancing already. So I haven't had to adjust too much. But the community here in Carlisle, beautiful Carlisle, has been awesome as well. I am locked in my house like everyone else. Um, so personally, I've been attending more meetings and online events like this one. Special shout out to FPRI and the Inter-American Dialogue for the wonderful events that they have offered online for free. I think it's really helped connect a lot of people. I've been able to participate precisely because I'm not working on my government computer. I'm working on my personal laptop. At the War College, this event really impacted us. We canceled our Americas regional studies travel to Brazil and Colombia, which would have been an amazing engagement to strengthen these strategic partnerships. We basically canceled the travel, disappointed everyone in Colombia, in Brazil, the students, myself, my Brazilian co-faculty, my Chilean co-faculty, and we transitioned to remote teaching within 2 days. So those are really minor impacts. I think what I want to talk about is some of the bigger macro impacts. Macro impacts that that we'll see throughout the conversation that are geopolitical, on our international relations, especially within Latin America and the Caribbean. Before I start, I'd like to clarify that the views I express are my own and do not necessarily reflect the official policy or position of the Department of the Army, the Department of Defense, or the U.S. government. And similarly, I do not reflect any official position from Foreign Policy Research Institute. This is purely academic. So I'll open to set the stage with the state of play at the start of 2020. At the time, U.S. relations were generally trending upward. Economic growth was not the best, but it was 1.3% GDP growth projected for 2020, lowest in the decade, but it was still growth. Democratic institutions were relatively stable, taking the exceptions of Venezuela, Nicaragua, and Cuba. We've seen some transitions back to elected democracy. We're still waiting on Bolivia's elections. But the social situation, unfortunately, was still fragile. As many of you know, those of you that follow Latin America, there's high inequality. Poverty was at 30.3%, extreme poverty at 11%. And at the end of the year, September through December 2019, we saw lots of demonstrations and public discontent, instability, if you will. Basically an expression of the population's frustration with the lack of state ability to meet their expectations, to provide for the state capacity to provide for citizens. Of note, and this kind of relates to our current COVID crisis, most countries in the region are underinvested in the health sector. They were spending on average 2.2% of the regional GDP, and the Pan American Health Organization, or PAHO, recommends 6% of GDP. So we know they were underinvested, and we'll talk a little bit more about the health sector in a bit. In Venezuela, we already had a pretty severe humanitarian crisis, just the conditions inside the country. That really led to about 5 million refugees fleeing the country looking for better conditions and livelihoods. 1.7 million of them went next door to Colombia. So that created more humanitarian a humanitarian crisis throughout the region, dealing with this incredible refugee population. And other concerns, trends, illicit trafficking flows. That's something at U.S. Southern Command. We look at that, particularly drugs, weapons, and just in general, the governments are looking at drugs, weapons, contraband, persons, trafficking in persons. U.S. in recent years has really been focusing on the illicit trafficking coming out of Central America and Mexico, through Mexico. And then the other thing we were seeing at the end of the year as we entered this 2020, January 2020, which is really going to be a new age with the advent of COVID-19, increasing influence and presence of the Federation of Russia and the People's Republic of China, both key importers of Latin America and the Caribbean commodities. So when COVID-19, the pandemic, spread to the Western Hemisphere, the region's stability was already, and well-being was already fragile and showing some concerning trends. So what has happened since January, and what will be the impact on Latin America of this pandemic? I've spoken in the past few weeks. I've probably, because of the social distancing and online nature of interaction, I've probably spoken to a lot more of my colleagues in the region and throughout the country about what's going on with COVID-19. And I've also been an avid follower of these Zoom events, so I'll share that. So COVID-19, I think one thing I've pulled out based on a number of words I've seen, like accelerate, exacerbate. COVID-19 will serve as an accelerant to much of the existing trends. And that, could go an accelerant either way, but hopefully in a positive way. So we'll see. Concern over COVID-19, if we look at when it hit, it was really slow to take root in the nations of the region. It did trail Europe, that the pandemic spread through Europe and North America, and it took a while for relatively speaking, the nations to really recognize the problem and respond. Initial responses. Is this the Zoom? Is my Zoom frozen?
I don't know. You're fine. I'm not sure what that was. Whether it was,
I've never had that happen.
we'll ignore it. I hope it wasn't me.
Yeah. Is everyone still there?
Yeah, we're all still here. Okay, go ahead.
I apologize. Phone calls go into my computer and I didn't know how to turn that off. So the responses really varied. They were varied in pace, varied in scope. Some were early, some were very strict in terms of containment and mitigation. Others were almost a complete disregard of the pandemic's risks and consequences. So I can go into that during the Q&A. Nicaragua, Brazil, Mexico were notably slower to take the pandemic seriously, if at all. For at least Nicaragua, Colombia, Argentina, Peru, Ecuador, they were early. Argentina, Uruguay, Chile, not as early, but taking full measures, following the advice of the international health experts. So, that's kind of how they reacted. And then looking at some impact that we're starting to see, or some concerns in the areas of democratic institutions, governance, and I'm going to just cite, one of the examples. Well, I'll discuss a little more, but El Salvador, they were the earliest and the strictest with their measures to help slow or stop the spread. And this was initially recognized in a very positive way, in stark contrast, perhaps, to some of the other leaders, like in Brazil, where President Bolsonaro initially said, oh gosh, it's a hoax, it's just a little cold. Where in Nicaragua, they hosted parades in the streets, love in the time of Corona, with people dressed up as the coronavirus. So very extremely different responses. In El Salvador, again, and on the 25th of January, they did the right thing. They canceled flights, started to follow all the right measures. But now, looking back in the past 2 months or so at what's been going on in El Salvador, and many have described these measures as draconian, and showing concerns in terms of undermining fundamental freedoms, rights, rule of law, and democratic principles. Examples, in February, and this is unrelated to COVID, but the president did invoke authority to hold and force the Congress into session so they could vote on the military budget that they may have been stalling. And he showed up at that particular session, bringing the armed forces with him, which is unprecedented, and perhaps a little bit of a blurring of the separation of powers. Sitting in the assembly president's chair, and things of that nature. Later on, he also used the pandemic to cancel sessions to avoid votes. And then other reports.
Excuse me, Barbara. We've had a couple notes that since the phone call, the sound has been lower. Can you speak up or get a little closer?
Yes, of course. Yeah. I will just speak up. I'll put my Army voice on.
Thank you.
Yeah, no, I do apologize for that. So, other examples are repeated challenges of Supreme Court rulings. He's pretty much flouted them. And his management of the situation and the measures of containment and mitigation did emphasize the use of the armed forces, but many of the directives went out via Twitter feed without coordination or communication with the other branches of government, their Ministry of Health and the other branches. And what that resulted in was some misinterpretation in the implementation, and observers have noted abuses by the armed forces with the civilian population, and large scale, they called them arbitrary arrests. So these are concerns. And this is really an example of one range of the impacts on democracy and rule of law. And many observers have expressed this concern, with leaders taking special measures based on the pandemic, not just to address the crisis, but really to increase power and move closer to an autocracy. But there is good news in El Salvador. It is still a democracy. So far, civil society, media, and the judicial branch have been reactive. They have been vocal. This is something that many of the observers say requires more attention from the international community. Some have even suggested the OAS, Organization of American States, invoke the Democratic Charter to censure El Salvador. In Peru, another thing that's been seen, Peru was took early steps to carry out measures, to mitigate and contain the virus. It still remains to be seen how successful they will have been, but they've done all of the right things, according to everything I've seen in reporting, to stop movement, to enforce social distancing, etc. And they've relied heavily on the armed forces. Now this has received a bit of criticism, and really an observation throughout the region of the reliance on armed forces. When I say armed forces, I mean security, police, and military. And I think that usually there's more of a problem with the military being involved with that. So they look at this as, some critics look at it as a militarization of humanitarian and disaster response, where the security forces could be taking lead, and also with a concern to the impact that will have on military influence in the country and the government later on down the road. So my view on this, because I've read this over the years, and as a foreign area officer working in embassies, we manage security cooperation with our partner nations. We help them build capacities. with the military in particular, primarily, if not entirely. There are some small exceptions in other instances. However, primarily we support the military and we build their capacity. And one of the areas we work in is humanitarian assistance and disaster response. In many countries, this is seen as very good for the military to focus on, and it is also within the authorities of their constitutions. And I'm also thinking specifically when I was senior defense official in Paraguay, I had responsibility for security cooperation. That was a big line of effort for us in our building partner capacity. But what I will say, all of our cooperation, all of our capacity building was always in coordination and support of the Secretariat of National Emergencies, or SEN, Secretaría de Emergencia Nacional. In fact, many of our donations went to SEN, and we would host interagency exercises, practices, capabilities so that they could work better together, so the military could better support a SEN, or Secretariat of National Emergency, directorate-led response. And in a country where every year there are floods displacing people, this was very critical. They also had forest fires like we saw in Brazil coming into at the beginning of this year also. So, the military forces do have this role in many countries as a part of their constitutionally mandated role. So I will say that. Now, again, I'm not discounting the observations or the concern with militarization of humanitarian assistance and disaster response. But I do want to emphasize that what I have seen is militaries in support of civil authorities, and our security cooperation has focused on strengthening their ability to support civil authorities. That's kind of my experience, and I will say it is true, just like it is in the US, that the size, footprint, and major capabilities that the military can bring to bear on any crisis often overshadows what the other agencies are doing. I was in Afghanistan, and no one really, you say Afghanistan, all you think about are soldiers, right? No one thinks about the thousands of civilians, USAID, interagency, that were over there doing other very important things as well. In national disasters in the US, we see the National Guard, a whole kind of a different lever, I will say, but we do see that. That's the face we often see, while they may not be the lead. And I think that's an important nuance, is that the size, footprint, and capability of the military is often what the population and the public zeroes in on or remembers. Now, that's one of the concerns, though, is that after the crisis, some critics feel, well, that's going to make them the go-to entity in these countries. They will have an unreasonable amount of influence in the country or in the government. And of course, that is a risk. But I would say that, at this point, that is very speculative, and it will always depend on the situations in each country. So it's true also, military forces, as I just said, often have the most capability and capacity for crisis. An example is aircraft, helos, fixed wing, planes. They can become air ambulances, they can fight forest fires, they can evacuate personnel, many things. And that's what, as I said, they do in many countries as a part of their constitutionally mandated role. And these platforms that give them this capability are very expensive, and they can't be in every sector of the government with the budget. I mean, I think the US and probably some other countries, we do have a Coast Guard. We have, aircraft in other entities of our government, but we also have a rather huge budget. So I'll just throw that out there, and that's really not, that's kind of off the cuff. So it's important to think they have to, the military needs them for their other missions, and they just have to be able to use them to support the rest of the government's efforts. And in Latin America, I'll just add this. This is an area, support to civil authorities. Everywhere I've seen it, it has been exactly that, mandated as support to civil authorities. In some cases, this is more apparent in the execution than in others. There are exceptions, but I will say this is an area where there has been a great deal of improvement in the region. Okay, and then here's another angle on that concern, is that because of all the capacities that and capabilities that the military brings to bear that actually deliver in a crisis, when we get into the budget competition among ministries, there's a concern that everyone will see that the military delivered, so let's put our money into the military. And that's a valid point, valid concern. And I think that's just something that bears watching, and continued advocacy on the part of the international community and those that would influence national budgets without violating sovereignty. That's another thing, they are sovereign nations. So that brings us, let's go to institutional capacity. They're worried about, overinvestment in military capacity, but not the capacity of other sectors like the health sector. So talking about the health sector, many nations, as I've said, underinvested at 2.2%, below PAHO's recommended 6%, Pan American Health Organization. Most facilities in the region are insufficient and geographically centralized or difficult to access. Gaps in access include health insurance and actual economic limits to access to health care. I think only 60% carry health insurance in the region on average. In the poorest sectors, maybe 34%. And that's if they're in the formal employment sector. And I think in some countries, informal employment, the person on the street selling waters or fruit or anything of that nature, that's not a job with a paycheck and taxes or Social Security, they're not tracked in those numbers. And when it, so that's an issue to think about. And I'll get to that in a second. So the system also was under pressure. That just recently the region had a dengue outbreak. I think 2 million people affected. I believe it was only in Brazil, but it may have been more than one country. So that's significant. The hospital systems had dengue going on, and that may be a problem. So this is just a bit of a panorama of the situation for the health sector, and the winter is on its way in the southern hemisphere. In some parts, that's going to complicate the health sector with also cases of influenza that come in the winter. So we've got a number of things that are going to layer, and quite frankly, this I think might be a little bit of an ominous foreboding, but there are positives too, I think. Poverty and extreme poverty. So, I mentioned the numbers, they expect that to increase. Who's going to be infected? Who's going to be affected? And in some cases, more likely to be infected would be the poorest of the poor, who are living in more crowded conditions, and again, don't have access to the health services, who work in the informal sector. Another aspect of that is that they can't just stay home from work and use a computer and telework. They can't. That's if they don't walk out on the streets, show up, pick up the newspapers to hold on the intersection at Avenida Fulano, they're not getting paid. So many of them have had to go out despite recommendations to social distance, which puts them and the community at risk. Now, what I haven't mentioned is in Peru, they have one of the largest aid packages for recovery from the pandemic, and also to help the population during this time where their economic income may be interrupted. One of the problems with that is that a large percentage of the population works in the informal sector, so getting the aid to them will be difficult, if not impossible, because there aren't formal mechanisms tracking those people, tracking how to pay them. So that is another concern. Economic recovery will be slow in the region, and that will also impact the poorest of the poor. So that's just, you know, a little bit of what we're starting to see and the impacts. The global responses, as you know, have varied between isolationist approaches and more multilateral cooperation. In the Western Hemisphere, and you know, in my past at U.S. Southern Command, we really focused on regional cooperation to kind of where nations, you know, we can't do it alone, we need to do it together. And I think we need to look at how is that going to play out in Latin America, the regional organizations and multilateral institutions. Earlier this month, in Foreign Affairs, there was an article referencing some changes, but another, you know, another expert also noted waning American leadership, and this moves on to where I'm going, and in going further with that idea to describe a disarray of the post-World War II order and American-inspired, meaning United States American-inspired multilateral institutions with discouraging impacts for Latin America. So that's Kenneth Maxwell out of Harvard making that observation. And that's where, you know, we have to wonder what is going on with the multilateral institutions in the region, and what is the U.S. going to be doing with them. And I'll put that aside, we'll circle back to that, because at the same time, China is and has been aggressively pursuing relations in the region over the past 2 decades, really. And they have a really strong presence that's been increasing tremendously and rapidly in the region, to include, they are actually a member of the Organization of American States, OAS. They became a member in 2004. There are more loans and financing from China banks than the World Bank and the Inter-American Development Bank combined. A couple other things: strategic partnerships with key countries: Argentina, Brazil, Chile, Costa Rica, Ecuador, Mexico, Peru, Uruguay, Venezuela. They're also a member of the Inter-American Development Bank, the Caribbean Development Bank, the Asia Pacific Economic Cooperation Forum, which includes a number of other countries in Asia, as well as the western coast of the Americas. They're working with the Community of Latin American and Caribbean States, which is a community that does not include the U.S. specifically. Their Belt and Road Initiative has 16 Latin American and Caribbean countries already signed on. So they're positioned very well in the region. And again, we can't forget the Taiwan, China situation. There are 9 countries in Latin America that still recognize Taiwan. So People's Republic of China is always in that diplomacy to gain more recognition in the region. And this all plays well with that. And then we bring COVID-19 into the picture. And as I think many of you may have seen in the news and heard of, not just in Latin America and the Caribbean, around the globe, they're aggressively messaging their success at dealing with the COVID crisis in China, their ability to provide aid now to and expertise to other countries. It's something that they're leveraging their soft power of diplomacy, mass diplomacy, and the region in Latin America is enthusiastically accepting any assistance. That's a concern. How is this going to affect the U.S. position in the region? And one thing I just want to say as a caveat, or maybe here's a question I've been asked. So where's the U.S.? How are we messaging? I'm going to say the U.S. is as fully engaged as we have been for the last century. And when I say for the last century, I'm talking about hundreds of billions of dollars in humanitarian assistance, disaster relief, support, and building partner capacity. Since the outbreak, our government has committed globally over 775 million in foreign assistance, and USAID 500 million. DoD alone in the region has already spent about 1 million, has sent to partner nations in Latin America and the Caribbean to help them with their capacity to respond and manage this crisis. USAID is implementing, a figure I'm not at liberty to share, but according to well-placed colleagues, USAID is doing a lot, and quite frankly, it exceeds Chinese contributions in most places. How are we messaging? Quietly. This is not the time for chest thumping. And some have said, and I'm getting ready to close on this, some have said China could come out with a boost to their already increased influence in the region due to messaging. Is it a geopolitical change in the order, in the world order of things? Will China take a leading role in this hemisphere? And I'm going to be honest, I want to say no. I don't think I have a full answer, but I am going to throw out there that we, the U.S., need to engage in the multilateral organizations and encourage increased multilateralism across this region. And I'll close with that, and I hope I didn't go too long. I thank you all for listening. Raleigh was generous in calling me an expert. I think I am just one of the followers, and I know there are a lot of experts out there even on this Zoom session, so thank you.
Thanks, Barbara. That was a real tour d'horizon of Latin America. Fantastic. We have a huge number of questions that have come in, so there's clearly interest in this topic. So we're going to have to get you back, I can see. But I have a couple questions I want to ask before I go to the audience. And one of them I have is you've talked a lot about the various countries in the region and a little bit about what the different governments are doing. But I would like to zero in on some of the specific leaders and who's shown good leadership, who's shown bad leadership, who's getting an A in the region and who's getting an F.
Thank you, Raleigh. That's a really good question. And I've thought about this because, I'd want health experts involved in the grading. But, it depends on what you're looking at. I would say for rapid response, the countries I mentioned, Peru, Colombia, Argentina, Chile, Uruguay, even Ecuador. Ecuador responded early, but Ecuador is one of the really sad stories of the region where they became the epicenter in Latin America. And we've seen the footage of the bodies on the streets there. So, who gets an A? Well, I think, despite any critique of the use of military, I do look at Peru doing all of the right things, all of the recommended measures, and perhaps where they really get an A is using those measures to buy time for improving their capacity because they don't have enough hospital beds or capacity. I think they're at 20,000 cases, if I'm not mistaken, right now, maybe a little more. And what they are doing, that's buying time. They're taking the facility that was used, the little city for the Pan American Games, I believe it was, and they're turning it into a medical care facility to accommodate the numbers they're expecting. So I think they're doing the right thing, taking the measures to hold off, contain as best they can, and building up their capacity for when the peak comes. So I would give Peru, a good score on that. Colombia was, from my experience in preparing to travel to Brazil and Colombia, they were putting out a lot of information early on tracking the infections in the country, um, starting to screen at their airport specific countries to all countries. So I give them high marks, and I think there are a lot of countries that did a lot of great things, and I don't want to understate what other countries have done by calling out the individual deeds that have stood out to me. Even Ecuador, according to the current health minister, who's just newly in place, um, they did everything that the international experts were recommending as much as they knew to do. One of the problems that the health minister recognized is that culturally in Ecuador, in Guayaquil, they're a very social population. Social distancing initially just did not compute, which I can see that. I have a lot of friends here in the States where social distancing did not compute. Did you ask me just who gets the good scores?
Yeah, well, I asked the bad ones too, but
I think I highlighted. I mean,
of the U.S. government, maybe you don't want to go there, but
no, I wouldn't go to the U.S. government, and I think the final scores, it really remains to be seen after COVID-19 is behind us, and then a real factor to grade everyone collectively globally, but the US, but Latin America, the multilateral organizations. How are we preparing for the next one? How are we going to work together for the next one? At Southern Command, we used to hold, and I think they still do definitely, exercises for humanitarian response. I think there were a long time ago, I remember an exercise for a pandemic on a cruise ship, chickenpox or some sort of fever, which would impact the Caribbean terribly. And by the way, this is impacting Caribbean tourism. There is none. So look at that economic impact. But we do exercises. We look at this. How can we improve how we do that for the future? And I really do think the multilateral organizations under CARICOM, the Caribbean Disaster Emergency Management Agency for all of the Caribbean, that's an amazing opportunity to do a lot better in the future. OAS, I know the Inter-American Defense Board, as of a couple years ago, had begun to build a humanitarian assistance disaster relief kind of database of who's got what, who can do what. I think we need to really put those efforts on steroids. And as a major power of the United States, whatever language you use to express that, we should put our weight behind those things, behind the organic institutions or regional institutions in the region, and hope that we can lead our neighbors to also put their all behind it. Same as we see around the world, where sometimes we have these great organizations, but not everyone's contributing their fair share. I think if we help by giving that example, that in Latin America and the Caribbean in particular, and we are putting in a lot, but I think to help encourage our partners to take these organizations seriously and use them. That was a long answer, sorry.
Thanks. Thank you. A quick question. This sort of gets at putting this in historical perspective. For decades and decades, there has been sometimes under the surface or over the surface anti-colonialist sentiment directed at the United States. A Yankee go home, we being the colonizers who have exploited the countries in Latin America. Is the pandemic, what's going to be the impact on that, of having this pandemic, more or less of this kind of anti-US, anti-colonialist, again, thinking of the US as a colonizer?
I think that's an awesome question, and I have mixed feelings about that. It could go in many directions, as anything could. But how is that going to affect that ugly American gringo go home kind of conception? As you know, or maybe not, many people in the audience know that in Latin America, sovereignty is sacred. And very often the US has in the past, and with all the best intentions, and maybe just translated poorly, gone in to help, but it's seen as a violation of sovereignty. And I think in this time, our quiet messaging and assistance that is not so it's not a brutal, whack across the head, if you will, or I can't think of the word. There's an expression. Our quiet help and assistance, that is what we've always done, because our solidarity with Latin America is unbroken, particularly in this kind of crisis when it's humanitarian. Is probably the right thing. It's not seen as trampling on sovereignty. We're not trying to undermine the sovereignty of nations. And I think, how is it going to affect the U.S., position in Latin America in general? And I've mentioned China. There are some that say China's going to take the lead in the world order, or at least in their relations with Latin America. I don't know that we're at that. I believe there is a good deal of suspicion in the region from my own close colleagues that work with me every day that are from some of the key countries in the region. They're going to accept the assistance. They're going to work with them. It's a pragmatic thing. But I hope, I have to say, I hope that we're moving beyond that. If the U.S. is providing assistance, we're providing assistance. And our history has shown, for the most part, our cumbersome assistance programs, which emphasize transparency, respect for human rights, and that can be annoying because they take so long because there's so much to do everything right. I think that in the long run, it will be appreciated because it's not trying to buy sovereignty or violate sovereignty. Excuse me.
Thanks, Barbara. Good answer. Interesting. One more question, quick one, before I turn to the questions from the audience. Colombia has, as you know, only very recently, in terms of the decades of issues with the FARC and the insurgency, only recently concluded a peace agreement. So we've got this peace agreement, and at the same time, Colombia has really sort of come into its own as an international player, and we all have, I think, friends who go to Cartagena for the weekend, or at least they used to. So what's the impact of this virus on all of that?
That's in Colombia. So the peace accord from 2016, that, groundbreaking, over 50-year conflict, internal conflict, tragic, a lot of human lives lost, and Colombia's come a long way, rounded the corner, and they have achieved peace, but a fragile peace, fragile in the implementation of the peace, the delivery of promises on that agreement. And they're not easy promises, providing, reintegration and jobs and, quality of life to the fighters that have left the battlefield is not an easy thing. It's already in many countries, not an easy thing to provide for all of the population, which is why we have some issues, even in the US. That is a huge, huge task. Coming out of over 50 years of conflict and making that move, reintegrating most of the FARC. And I say most because there are, I believe, about 500 fighters, but I may not have the number exact, that have returned to the battlefield because they're disillusioned with the peace process. So that's sort of an issue that the government has to deal with. Not only implementing the promises of the agreement, which are very important for lasting peace. On top of it, the instability in Venezuela, and I mentioned the 1.7 million refugees out of Venezuela into Colombia, straining their government services, their system really to receive them. And Colombia prior to COVID had opened their doors and welcomed them because Venezuela had done the same for them in their history. So fragility exacerbated by Venezuela, immigrants, and that strain, exacerbated by just the difficulty of any peace process implementation. And now we've got COVID. What is that doing? I know, and I don't have the exact facts and figures, but at the border, they've had to change the way they're doing things with Venezuela. Yeah, what is this going to do to the peace process? That I don't have an answer. I do think Colombia is providing the services they can, and I haven't. Yeah, it's something that bears watching. Really, it bears watching. Because as I mentioned, all of the impacts on economic, social conditions, that plays into the peace process with not only the reintegrated FARC members, but also those in the lowest economic levels of society that are already suffering as well. So, yeah.
I'm going to turn to some questions from the audience. And as I said, I'm not going to be able to get through all of them. So let's maybe do sort of rapid fire. While you're on Venezuela, you know, as the world has this recent collapse in oil prices, Venezuela already had, you know, severe economic problems. So now they've got the collapse of oil prices and coronavirus. What's the impact, any possibility of a President Maduro exit?
You know, we have seen in the past some reports of possible talks between the recognized legitimate President Guaido, opposition, and the dictator Maduro. I'm sorry, these views are my own. We have seen the possibility of talks or a truce between opposition and Maduro because of the crisis, but we haven't seen it. So, you know, my hope is that, yeah, people will put things aside and move on, because pretty much what all of the experts are saying is Venezuela is a humanitarian crisis on top of a humanitarian crisis. I didn't think it could get any worse. And you're right, the oil, the drop in oil prices, the fact that I believe even Iran is shipping fuel to Venezuela. This is just beyond. I mean, we talk about COVID-19 unprecedented. The things that are going on in Venezuela are unprecedented. So it is worse than anyone can imagine. One hopes that either the two sides will come up with, you know, there is a plan to try and have democratic elections in the country. Let's hope they can get to a table to where they can get to a place to do that. Of course, you can't do elections during COVID-19, as we see in Bolivia, where, you know, Evo Morales left Bolivia, basically was kind of popularly run out, and they're supposed to hold elections on May 2, and they've postponed them. Some people think that's due to COVID-19. Some people see that as a power grab as well. And I know I moved off Venezuela, but yeah, Venezuela, I see no light at the end of the tunnel unless Maduro steps down and allows, you know, others to take charge, and in this case, maybe the military. And again, it's just me, who would be organized enough in the chaos that's Venezuela, you know, and then, you know, let them get to a point to get over the COVID crisis, and you know, bring in more foreign aid, if they can be you know, get to that point, and then have those democratic elections as soon as possible. Really, that's what Venezuela needs. Will that feed people? Will that cure COVID? No. They need to, you know, address that right away.
You haven't talked much about Europe. Is the European Union playing any particular role in Latin America?
You know, that's really a good question, and actually not one that I've really researched. I think that they are sharing a lot of information. You know, as you know, the EU and Mercosur early in the year, or actually at the end of last year, I believe, ratified their free trade agreement. So trade is, going on between at least one of the blocks in the region. But what is the role the EU is playing right now? That is a question I don't think I could answer, fairly. I wouldn't want to give false information.
Okay, I'm gonna do one last question, and I'm gonna tie a couple of themes I see in the questions from the audience. There are the U.S. the border, the Mexican border. What's the impact in terms of the U.S. border, and bringing in as well organized crime, and gangs, for instance, MS-13, B-18, they're also affected by this, facing a loss of revenue. And maybe not appropriate to tie that in with the border, but maybe a little bit. So
yeah, I think there's
figure that out.
there's a couple of threads that triggers for me. First, I'll talk about some of the gang type groups. And I think the same had occurred in Central America, though it may well be coming to an end in some places. Where there are spaces where the gangs basically control, kind of ungoverned spaces within cities, within countries, the gangs initially, for example, in Brazil, in the poorest communities called favelas, they actually were taking on the role of government services. They were enforcing social distancing. There are some accounts of the gangs handing out hand sanitizer and also reprimanding those who were not wearing face masks. So, I'm not saying that's a good thing exactly. We know that when illicit groups take over the role of the state, you have lost, there's no governance there. Someone has taken the state role. So that's very negative. But the fact that they were doing something constructive in their communities, okay, but then the question is, were they following rules, or were they abusing, and how were they treating the residents of those communities? That's just a thread that comes out of that in reference to gangs. I do believe something similar was occurring in maybe it was Honduras, but I'd have to go back to my notes. But then the border, going to the border, I'll go back to the conversation or what we've seen kind of playing out in the media right now with the deportation of illegal immigrants from the United States back to Guatemala, and one flight of deportations, or multiple deport flights maybe, had over 99 cases of COVID-19, which has really complicated the way we manage the immigration, deportations, and border control. And again, one of the things affecting not just the border, but throughout the region, anywhere where you have detainees. Now we have a problem with social distancing, sanitizing the facilities to the extent you need to avoid contagion of the disease. So, these are some concerns that are really weighing heavily on those responsible for these missions.
Thank you. I think we're out of time, unfortunately, and there are just at least dozens of questions that we don't have time to answer. But I would like to send my sincere thanks to Colonel Fick for joining us today, and to our audience also. Please remember, we can't bring these events to you without your support. Please consider a donation, tell your friends about us, and please come back and see us again. I'd also, in addition to thanking Colonel Fick, thank our Deputy Program Director for Eurasia, Maya Otarashvili, who actually introduced me to Barbara and brought her in and helped make this event possible, and also to Jess Taylor and Eli Gilman at FPRI for all the work they did to make this event possible. Thank you again for joining us, and hope to see you at one of our future events. Take care and stay healthy.
Thank you to everyone in the audience for joining in. I look forward to seeing you again.
Thank you. Bye-bye.